action. Hello, everyone. This is Dr. Mike Chua, physical therapist and certified dementia practitioner. And today we are going to post this on our Misunderstanding Dementia page and also on our Alzheimer's and Dementia support group. Today, we've got a special guest. We've got two occupational therapists, awesome occupational therapists, Terri Cassidy and Kathryn Seibert. Is that how you pronounce it, Kathryn?
Yeah.
But they are both occupational therapists. And you know what? Their specialty is actually Driver Rehabilitation Specialist. They're both certified Driver Rehabilitation Specialists. And if you are having a loved ones that are wanting to drive or still wanting to drive or having difficulty driving, this ladies here they're going to help us out how to figure out how to take care of your loved ones if they still really need to drive or not. So again, thank you very much, Terri and Kathryn. I appreciate you for having coming over. And yeah, did I miss anything? Can you introduce yourself again too?
I think, yeah, thank you. That's awesome. Kathryn and I work for a company that called Health Promotion Partners. We do the Fitness to Drive program. So we do a lot with older driver evaluations.
Oh, wow. Oh, wow. So first of all, where are you guys located? I mean, what city and state? So
we are in Colorado Springs, Colorado, which is about 60 miles south of Denver. And we are the only driver rehabilitation program south of Denver. So we serve kind of all of southern Colorado. There are only a handful of driver rehab specialists in Colorado, and there really aren't even that many throughout the country. And with the aging population that we're seeing, we just really feel strongly that this is a great opportunity, especially for OTs, but other rehab professionals as well, to use their skills in kind of this niche market.
So basically, my next question is, we're going to be putting this up on that Alzheimer's and Dementia support group that we have. So how would we know if a patient really needs to still drive or not? I mean, I know that's your specialty. So how would you know?
Well, when we're talking about the dementia patient, first of all, we kind of know, and research tells us, anybody with moderate to severe dementia probably shouldn't be driving. Those are kind of the people that are easy to make the determination on. Those are the folks that they're going to get lost. While they may be able to operate the motor vehicle, they will likely forget where they're going. They may get lost. They may end up driving, all the way to the next state. So those are really the people that we're focused on in our practice. We are looking more at the people that have mild cognitive impairment or mild dementia.
MCI, yeah.
Yeah,
I remember now. Okay, go ahead.
Those are the folks that really are kind of on the border, right? Their loved ones are concerned, but they don't know really if it's time to take the keys away. So we have people ask themselves some questions. We'll say to the loved ones or the caregivers, will you drive with this person? Will you be in the car while this person is driving, or does that scare you? Will you let this person drive your children? That's a big one. So if I'm an adult child and it's my mother that I'm concerned about, and I have young children, if I won't let my mom drive my young children, that's probably a sign that my mom maybe needs to be evaluated by a driver rehab specialist.
Driver rehab specialist. Okay.
We also say to the loved ones, do you spend a lot of time co-piloting? When your loved one with dementia is driving, do you have to do a lot of co-piloting? Do you have to tell them to stop at the stop sign? Do you have to give them directions? Do you have to direct them on where to go? Do you have to remind them to turn on or turn off their turn signal? All of those types of things. Those are all really good signs that it's probably time for your loved one to be evaluated.
Oh, wow. So when you say evaluated, do they need to go to your office, to your clinic to be evaluated? And then you mentioned about moderate to severe and mild cognitive impairment. What kind of testing do you use to, I know the doctor, the physician would say, okay, this has dementia. And then normally the patient don't even know what stage the patient is. So do you do the testing? Do you do any standardized test, like whatever GDS or whatever you guys do as an occupational therapist?
Yeah, do you want to take that one?
Sure. So in terms of some of the testing that you're talking about, sounds like dementia scaling or staging. We aren't necessarily diagnosing for sure, and we do have the information from the doctor. But what we most care about is function for that particular client. So we're going to do a lot of standardized tests around vision, strength, range of motion, the skills you need for driving. We will look at cognition. So we generally use the MOCA as part of our executive function assessment. We'll do the short blessed test in terms of like a dementia screen. But testing that's already been done is really helpful to us too. So if that individual has had a neuropsych report, we'll ask for a copy of that, medical records, things like that that will contribute to what we're finding. And then we'll do some performance-based assessment sometimes before we get in the car. And then obviously in vehicle is our true performance assessment.
Oh, wow. You mentioned about the vision, range of motion and everything. And I think that's very important. And most of the time I'm not, I got good physician friends, but they say, when they say, okay, you're still good to drive, but I see the patient, they don't have good range of motion in their neck. They're, you got your patients like this, and then their eyes, they don't even have that, oculomotor eye reflexes anymore. And, if you have a loved ones right now, if you're watching and listening right now through our podcast and through our, group right now, you need to go to a certified driver rehab specialist. So how do we find certified driver rehab specialist? Is there a website that we can go to, Terri and Kathryn? I mean, aside from your own website, we'll promote your website. But I mean, for example, I'm in Tennessee. Is there any association that I need to go to? Or
yeah, so the association that credentials therapists to be a driver rehab specialist is called ADED. It's ADED.
ADED.
Yeah, the acronym doesn't necessarily fit, but it's ADED.net. AED.net. And there you can search for either a driver rehabilitation specialist or a certified driver rehabilitation specialist in your state. There's a provider search, and you can go in and search for somebody that's near you. Enter your city, state, and zip code, and they will come up with some resources for you.
Wow.
There's also another directory on the American Occupational Therapy Association. So on AOTA's website, they have a OTs who focus on driving. They have a directory as well.
So for our listeners and people who are watching right now, AOTA is help me out here.
American Occupational Therapy Association.
There you go. American Occupational Therapy Association. So you go to that website and search, driver rehab specialist in my area, or, if you're in Tennessee. So, because it's very important, because I'm saying this in a nice way, not all therapists are the same, just like any doctor. No, not all doctors are the same. You go to a pediatrician, you can't expect her or him to know everything about the heart. You go to a cardiologist, you don't expect them to do surgery on you for your knee. So same thing with us therapists. I'm a physical therapist. These two beautiful ladies here are, occupational therapists, and they have their own specialty. So go ahead, go check the website at AOTA and ADED.com. So, I have several questions here that I have. So how do you know if someone should either retire from driving or should be assessed by a driver rehab specialist?
Well, one of the things we like to say is that when we're talking about dementia, the diagnosis of dementia, it's not really if, but when.
Oh, wow.
There will likely come a time when the person is going to need to be evaluated. There's strong evidence that mild cognitive impairment progresses to dementia. And so we like to say to people, the earlier the better. Again, we also tell loved ones to ask yourself the questions that we talked about earlier. Will you drive with this person? Do you co-pilot? Would you let this person drive your children? There are also a few questionnaires that people...
My wife won't let me drive my kids.
Well, come see us, Mike. We might be able to get you in next week.
I know, right? It's different, right? It's not cognition. It's just my hormones. So... Oh, well. All right. I'm sorry for disrupting your train of thought there.
One of the other ways that you know that a person might be having difficulty with driving is when they're having difficulty with other ADLs or other IADLs. So when the person,
What is ADLs and IADLs?
so
Or I mean, yeah.
yeah, ADLs it stands for activities of daily living. So those are things like dressing, toileting, bathing, feeding yourself, including on and off the toilet, in and out of the shower, all of those types of things. IADL stands for instrumental activity of daily living.
There you go. Mm-hmm.
And those are things like that require higher level executive function. Those are things like balancing the checkbook, preparing a meal, driving. So if you find that your loved one all of a sudden can't balance their checkbook, or all of a sudden is burning things on the stove, or goes to the grocery store and comes home with only half the items that they needed, that also may be a sign that it might be ready to start talking about driving.
Oh, wow. How long does it take for an actual evaluation that you do? If, for example, I have my mother, rest in peace, my mother and my dad, right? But for example, I bring my parents to you. How long does it take for an evaluation?
That's a good question.
Mm-hmm.
So generally we schedule a 3-hour appointment.
3 hours? Oh, wow. That's so quality. Oh, gosh. That's so good.
It's very thorough.
It is in depth. And a lot of things that Kathryn mentioned are things we talk about in that, even just the clinical portion of that. So we are finding out, how's this person doing with managing finances? What types of responsibilities are they keeping up with at home? So we really get a full picture. Also, we want to be looking at what type of driving are they doing? What is their driving environment? Because for one person to continue driving to the grocery store and to the bank is different than somebody else commuting back and forth to Denver. So it's really very individualized. But we'll spend about half that time in the clinic, a good portion of time out in the car, and then really the most important part is when we come back, hopefully there's family there and have the discussion about how it all fits together.
Oh, wow. You know what?
We really look at the whole person from head to toe, including taking them out in the car. We have a driver trainer car that has a brake on the passenger side.
Very important.
So
Really?
So we're yeah. The other thing,
I attended the seminar with Tipa Snow, and there's this. He's actually an occupational therapist here in Jackson, and they do this, and they have a simulated car, in their booth. And I said, "Oh wow, this is amazing!" And I remembered you guys actually. So
a lot of places use a simulator, which is terrific. It's a really safe way to get an idea of whether or not somebody will be safe to take out in the car. We do find that actual behind the wheel in the car is really the gold standard of
course, yeah, because all the what you call this, the peripheral vision being activated and everything. So yeah, that's so true. Well, my next question for you ladies is how do you talk about driving with persons with dementia? I mean, yeah, that's your question there, right?
Yeah. The first thing we like to say to people is that you need to start the conversation early, and it's an uncomfortable conversation, but it's really mostly for the benefit of the family member. We like to phrase it in terms of what we call driving retirement. We like to say to people, when you're planning on retiring from your job, you don't just wake up one morning, go into your boss and say, I'm retiring today. You might if you win the lottery or something, but typically it's something that you plan for. You talk about things like, how is it going to affect me financially? What am I going to do with my time? What are some things I want to do in my retirement? Will I be able to pick, what is my role going to be in retirement?
Oh, wow.
So we like to phrase the tapering of driving in terms of driving retirement. And so we like people to be able to plan for it. Where do you need to go? Where are the places that you are going to need to get to? What are some other driving alternatives in your community? Can you use Lyft? Do you have access to Uber? There are other apps and other services that can help with transportation as well. The time to teach somebody to use the bus, for example, is not the day that you tell them that they can't drive. It's something that you want to start conversing with your loved one about early.
Oh, wow.
There are a couple of resources too that the Hartford, the insurance company, the Hartford puts out. If I hold something up, will you be able to see it?
Yeah.
Okay.
Or
So this is I'm putting it in front of my face.
that looks like me 70 years from now.
Oh my God.
Oh gosh. Yeah, I think really put that in for me, right? Dad,
You could be a model.
Yeah.
So this publication is called We Need to Talk, and it has a lot of great information in it. And this one is called At the Crossroads. These are free publications from the Hartford.
Can they download that?
They can download it, or you can right away, and they will mail one to you.
So what's the website again?
I believe this.
Notes.
These are, yeah, we can send it to you. We'll put links for these in the show notes.
Okay, so yeah, so for those people who are watching right now, we're gonna put it on our blog post, and that way you can download a copy, or actually send them an email or a letter, and they will send you that information too. Am I correct?
Right.
Terri,
Yes. Yeah, they would. The other thing,
and it's free, right?
Yes, these are free.
Good.
Starting these conversations early is really important. One of the other things we like to tell people, or information we like to share with people, is that research recently has shown that men will outlive their ability to drive by about 6 years, and women by 10 years. So we all are going to need to figure out alternate ways of transportation in our golden years.
You know what? That's so true. I mean, I live in the rural area, and I see a lot of patients that are still driving, and it's very scary. You know, I think 2 or 3 months ago, I just saw, an old Buick right in front of me in the highway here, and it's an old person because it's an old Buick, and it's just crazy. And actually, one time when I was the director of the hospital outpatient, I did a driver evaluation because the doctor specifically ordered, "Hey, Michael, can this patient really, safely drive?" And I'm not comfortable. And I said, well, let me do, an evaluation. So part of the goal is to get in and out of the car, to be able to get their walker out of their, the trunk or the back, the back of their seat and stuff like that. And we were able to do that, but it's just hard to really talk to the family, an actual patient, to tell them, hey, you can't drive anymore. So how do you, I guess my question is, how do you tell them, especially if they got dementia, how do you tell them, hey, Dad, hey, Mom, I know you need to titrate, I know you need to start early, but what if it's too late already? They're in that moderate stage and they still want to drive. Functionally, they can still stand up and walk, and they need to go to drive. How do you tell that to your loved ones?
Yeah, and I would just say sometimes that's the main reason people call us, is to have like a third party involved, so that we can be the ones who initiate that conversation. Or sometimes it's easier to have that conversation when there's been some testing and some objective data to back it up. So sometimes the family is aware that it's time for this person to stop, but they need a little support in that process. And, we'll say we'll be the bad guy, or we will take that on, because it's a lot easier than when it's your own family member. But I think, well, a couple things. Even with us, it's not always pretty. So there's definitely that there. And then families are, the dynamics of different families vary so much.
I bet you got this family members like, yeah, I told you so, you don't do the driving. And you got this family members like, oh no, that is okay. So I bet you.
Sometimes both of those people are in the same family. So you have one person who's saying, I told you that grandma should not be driving. And the other person is saying, if grandma can't drive, who's going to pick my kids up after school? Right? I mean, there's a lot of family dynamics that go on there, and it can be very touchy.
And OTs are good at this, family dynamics and everything. You guys are really good at that.
Yeah.
I think sometimes it can be, sometimes I've seen individuals come in who the family's already warned me they're going to fight this tooth and nail, let's say. And sometimes by the time we do our whole 3-hour session, something about that clicks. Like there's a piece where they start to have, even though insight may be an issue overall, there's one time I drove with a gentleman who had already failed the test at the DMV, but wanted to keep going back and take it again and again.
Mm.
And from our eval, I was saying, he's not going to pass. Like, it's not a good idea to keep taking this test over and over. But by the time we were finished together, he was more like, I just need someone to drive me to the nursing home to visit my wife. That's
yeah.
Ultimately, as OTs, we want to get down to what's important to you. Driving right now is a barrier, but how can we still get you to those things that are important? And that's where trying to problem solve with the family. Sometimes that individual can be on board with that, and sometimes it's not.
And sometimes people can be approved to drive under certain restrictions.
Mm-hmm.
Right? Sometimes it's a 5-mile radius from their house only during the daytime, for example, and not in bad weather or things like that. I mean, it can be graded.
That's me with my wife. So we're just
within reason.
Yeah.
One thing I will say for pretty much anybody we see with a diagnosis of dementia, if they pass, and it definitely happens that they pass. We don't mean to come across that everybody fails our test. There's times when there's parts that we do in the clinic that don't look very good, but then there's so much muscle memory, there's so much routine with driving that they're able to compensate for quite a while. But our recommendation and kind of American Academy of Neurology recommendation is to be retested. So we would say come back, let's say somebody does pass, come back in a year, or if the family and doctor is noticing functional changes before then, come back.
Oh, wow. All right. I guess my next question is, all right, so it's a 3-hour evaluation, and I wanted to bring my loved ones to you. How much does it cost me? Does my insurance will pay for that? Will Medicare pay for it? Private insurance, or is it cash pay, or what? How does this work?
Well, believe it or not, Medicare does not think driving is a medical necessity. I know it's shocking, but this is not a covered service. So we are a private pay company, and our 3-hour evaluation is $385.
It's not bad.
No, right. I would say across the country, the range is somewhere between 3 and 5.
3 and 500.
Mm-hmm.
Tell people, when you take into consideration the cost of an accident, or the cost of repairing your car when
even something minor.
Even do something minor. Even a fender bender is going to cost you $1,000 to fix your car, or the cost of your insurance that's going to go up. All of those things. When you take all of that into account, we think it's a reasonable price to ask.
And I think peace of mind is the main thing that families leave with.
Right.
You cannot pay the peace of mind. I mean, I would, I know 385 is 385, but if you're going to do this for your loved ones, so this is for the people who are watching and listening right now. If you're really concerned on what's going on with your loved ones, whether they got dementia, Alzheimer's, stroke, or whatever, when they hit, the age of what you call geriatric age, which is obviously 65 and above, I would recommend an actual driver rehab evaluation. Why? Because when you hit that age, your cognition slows down, your reflexes slows down, your eye movement slows down, and it really affects your ability to be driving safely. Actually, I don't know if there's a law that needs to be done. I think, when the patient hits 65, I think they need to go back to DMV and have an actual checkup, because normally it's like, how many years do you get your license renewed?
It varies. Colorado is 5.
Every 5 years.
Every 5 years.
Yeah.
I'm not a citizen. That's why I have to renew it every 2 years. So, but, I think they need to do that, going back. Remember when you go to DMV, you go and have your eyes checked and everything like that. If I put my eyeglasses, I feel that. And they need to do that. So I think you guys are doing a good job providing a very good service for your community. And thank you very much, Terri and Kathryn. So
yes, you're very welcome.
Before I let you go, how can we reach you? What is your website? What's your email? I mean, what else? Last tip that we can get from you guys. I mean, you got 2 OTs here, awesome OTs, occupational therapists, and we want to squeeze your brain out and provide valuable information to our friends and members in our group. So,
well, the best way to reach us is through our website. So it's www.healthpromotionpartners.com.
okay, we'll post that on the show notes too.
Thank you. And then our emails are our first name and then Health Promotion Partners. But there's links to all that on the website.
Okay. So you are based in Colorado, and then healthpromotionpartners.com. And then again, thank you very much, Terri and Kathryn. Any last tip for our caregivers who are taking care of their loved ones?
I would just say hang in there and reach out for help. It can be a daunting task, and if you are concerned, you probably have reason to be concerned. And we are here to help, as well as other driver rehab specialists across the country. That's what we're here for.
Awesome. Do you also have your own Facebook group that they can go to, like a drive?
Health Promotion Partners has a Facebook page. Our company is called Health Promotion Partners, and the driver rehab program is called Fitness to Drive. Fitness to Drive.
Okay. All right. So is there an online thing that they can reach out to you to, or do they really
message us through Facebook if they wanted to?
Awesome. All right. Well, again, thank you very much. So if you guys are watching, listening right now, and you really feel like, that your loved ones needs to be evaluated, well, you're here. You're in this group right now, Alzheimer's and Dementia Support Group. You need support. Reach out to Terri and Kathryn, healthpromotionspartners.com. We're going to put the show notes, show links, and everything like that. Reach out to them, pick their brain. You don't have to pay the $385 immediately. Talk to them first. And then if you really need that evaluation, go ahead. It's worth every single penny. You know why? I know some therapists, they charge $300, $400 for a 1 hour treatment. This is 3 hours full driver's evaluation. And I think it's going to be worth it, especially if you are taking care of your patients who have dementia. Again, thank you, Terri. Thank you, Kathryn. Appreciate it. I hope you have a good day, and I will see you around. All right. Always remember the word fast before you go. I have this last spiel, right? The word fast. F-A-S-T, my friends. F-A-S-T. F is like our Facebook page. Subscribe to our page, Misunderstanding Dementia. Subscribe to Terri and Kathryn's page, because the more likes, the better. And also we get to communicate with each other. And letter A. Take action. All these videos, all this interview that we're doing, it's not going to do me good. It's not going to do Terri and Kathryn good if you don't take action on it. Take action. Talk to them. Reach out to them. All right. Letter S. Share this page, share this video, share this podcast or whatever we're posting this, because the more shares, the better, because it may not be applicable to you, but it could be applicable to somebody else, your neighbor or whatever, right? And last but not the least, letter T, teach it. Teach the information that you've learned, because Terri and Kathryn, they're teaching it. If you learn and teach it, you're going to be able to understand it, because when you hear it, you forget. When you see it, you remember. But when you actually teach it, you understand it more. And that's what Terri and Kathryn is doing. They understand this because they're teaching it. All right. Have a great day. God bless you. And I'll see you around. Bye-bye.
Bye-bye.
Thank you.
Thank you, Kathryn. So